So now let's start looking at the evidence. I'm going to focus on HPV, dengue, hepatitis C, and HIV, respiratory infections, and the so-called novel coronavirus or COVID-19 virus. So topic number 1, human papillomavirus. These are the viruses or the virus family that causes skin warts and also famous for being associated with cervical cancer and probably receiving too much blame for cervical cancer. So let's look at this article, Long-Term Vitamin D Supplementation on Regression and Metabolic Status of Cervical Intraepithelial Neoplasia. This was published in the journal Hormones and Cancer in 2017, February. This was a randomized, double-blind, placebo-controlled trial of 58 women with cervical intraepithelial neoplasia grade 1. So we can basically consider that an early type of cervical cancer. Commonly, this regresses spontaneously, but it can progress into stage 2 and 3, which ultimately becomes clinical cervical cancer. Patients in the treatment group received 50,000 international units each 2 weeks, which provided about 3,500 international units per day for 6 months. And the effects are as follows. Number 1, after 6 months of vitamin D administration, a greater percentage of women in the vitamin D group had regressed their CIN1 status, which basically means that this precancerous state had resolved or returned back to normal tissue. Effect number 2, they had improved vitamin D status as we would expect. They had reduced insulin levels and improved insulin sensitivity. They also showed improved antioxidant defenses and reduced oxidative stress, and that's because vitamin D plays a role in antioxidant defense and glutathione metabolism. Of course, the vitamin D supplementation showed excellent safety. So my summary is this is a good study with positive results, should drive clinical care and public policy, especially when affordable, available, and providing multiple benefits, as we know that it does. CIN1 resolution appears to be facilitated by vitamin D supplementation, but probably these patients who were overweight actually needed higher doses. Another irony that I've noticed in medicine is that for the most part, the medical profession refuses to acknowledge the benefits of vitamin D, but they're quick to use a pharmaceutical version of vitamin D that's not the natural form of vitamin D. So here you can see successful treatment of anogenital wart with topical vitamin D derivatives. So this would be a synthetic form of vitamin D that's actually not the nutrient. It's a drug modified form of vitamin D. And again, my comment here is that the medical profession consistently ignores the data on vitamin D, and then they turn around and use a pharmaceutical version of the exact same nutrient that they're ignoring. And we see the same thing happen with melatonin. For example, when I was in medical school, so this would have been, this particular lecture that I'm thinking of would have been back in 2006 or 2007, one of our professors specifically warned us against using melatonin, but then he was happy to advocate a list of drugs that acted at the same receptor. So of course that doesn't make any sense. These drugs working at the same receptor could easily be replaced by the endogenous agonist of that receptor, which in this case is melatonin. So I think we should use the natural agonists of these receptors. The natural agonist of the melatonin receptor is melatonin. The natural agonist of the vitamin D receptor is vitamin D, and especially 25-hydroxyvitamin D. So let's look at this publication from the Journal of the American Academy of Dermatology in 2020. This is a systematic review and meta-analysis on the use of intralesional vitamin D3 injection in the treatment of warts. So the authors note that vitamin D3 is comparable in efficacy to other pharmacologic agents. And again, this is a systematic review and meta-analysis of 14 studies with 480 patients, showing that intralesional, meaning injected vitamin D3, was significantly more effective than placebo. The pooling of all studies indicated that about 60% of all patients received complete resolution, and that almost 80% achieved resolution of at least 50%. And as I mentioned before, this particular publication, which again is a systematic review and meta-analysis, also noted increased serum interferon gamma after vitamin D3 injection directly into the wart. So again, they're talking about vitamin D3 injection into the warts to promote resolution of those warts. Now let's take a look at the details, and I think you're going to find this very interesting. The most common doses used were 10 to 20 up to 60 milligrams, which comes out to at least 400,000 or 800,000 up to 2 million international units. So basically what they're calling intralesional vitamin D injection is basically supraphysiologic bolus dosing of vitamin D by injection. Now, since it's by injection, it's going to have different pharmacology from orally administered vitamin D3. And that would include probably a delayed tissue release, which actually prolongs the release of the vitamin D3 into the system. So quite clearly, this article supports the use of vitamin D3 against HPV infection, in this case specifically the type of HPV infection that results in cutaneous warts. But because of the systemic effects, I think you could apply it topically, inject it locally, or take it orally. And again, part of the benefit is mediated by increased levels of serum interferon gamma. I showed you this article previously and in video number 4, showing that vitamin D administration increases interferon gamma levels, and we just saw that again repeated in that meta-analysis. This article is Intralesional Vitamin D Injection May Be an Effective Treatment Option for Warts. This was published in the Journal of Cutaneous Medicine and Surgery in 2016. This reviewed 20 patients with warts. Vitamin D was injected into the base of the wart every 4 weeks, and each injection provided 60,000 international units. So we could debate whether this is local therapy or systemic therapy, and I would advocate that the correct answer is this is a combination of both. It probably does create some local effect, but it clearly also increases the systemic or whole body vitamin D status. And in the picture from this article, you can actually see the clinical results. So here's the wart, which is actually infection with HPV. This was injected with vitamin D3, and that resulted in relatively rapid and almost complete clearing of that wart. These types of plantar warts are notorious for lingering for years, so the fact that this resolved within 1 month is actually very remarkable. So any patient bothered by this would be very happy to have this relieved within 1 month of therapy. And especially being able to avoid other types of treatment, such as freezing or chemical burns. Vitamin D is highly effective for warts. 80% of patients showed complete resolution of their warts. And the authors here conclude that intralesional vitamin D injection may be a new treatment option for warts that are unresponsive to so-called conventional treatments, which typically either includes freezing or chemical burning. And again, I don't think this has to be injected. You could probably apply it topically, or you could take it systemically and still expect good benefit. So my final comment here is injection therapy, with all its formality and risks, sounds more professional and certainly bills for a higher rate than does recommending oral vitamin D supplementation. Now let's take a look at another wart growing from underneath the fingernail or toenail. These are called periungual warts, and you can see the appearance is quite disagreeable. So let's take a closer look at the dosing here. This is vitamin D3, available as 600,000 international units, provided in the form of 15 milligrams per milliliter. So that's 600,000 units per milliliter, and the author states that 0.4 milliliters is used per treatment. So that's 600,000 times 0.4 for a maximum of 4 treatment sessions, as you can see here. So this is 960,000 international units injected locally. As I said before, we know that that vitamin D, which is injected locally, has a systemic effect, and perhaps all of the effect is systemic because we know that gamma interferon levels increase following these vitamin D injections. And here you can see the clinical response, a very aggressive wart here, becoming progressively more manageable until it's completely normal. And all of this occurred within about 5 weeks. So again, very safe and very satisfactory result here. In 2019, the British Medical Journal published what, in my opinion, are some very unusual articles supporting the use of the anti-HPV vaccination against cervical cancer, which, based on a very simplistic model, is caused by human papillomavirus infection. Basically, what they did in this article and the accompanying editorial is they looked retrospectively at the prevalence of HPV cervical disease in Scotland, and they said, wow, the prevalence of the disease started to decline after the initiation of vaccination. But my comment here is that the vaccine campaign started at the same time that the government and local nonprofit organizations started implementing nationwide vitamin D supplementation. So supposedly this was an epidemiologic study, but it was a complete failure because they overlooked the nationwide program in Scotland to improve vitamin D status. And like I said, they repeated that same mistake in the accompanying editorial, which happens to have been written by someone who was funded by the company that makes the HPV vaccine. As you would expect, her editorial gave glory to the vaccine and completely failed to consider other trends, especially the vitamin D supplementation programs that were occurring nationwide in Scotland at the exact same time. So you can see both of my replies at the website of the British Medical Journal, and you can also see that same information published in an editorial that I wrote for the Journal of Orthomolecular Medicine in June of 2019. And within that editorial, I included all of my correspondence with the editors of the British Medical Journal and the two publications that they posted on their website.